A federal report published this week shows some big differences in the same procedures nationwide and also right here in the capital region. How much does your local hospital cost? Well, Matt Markham has our top story live from the newsroom, and it breaks down by some pretty common operations, Matt.
Indeed, Dory. Here's part of the report. We've been going through it all day here, and it reveals numbers on how different a procedure can be at different hospitals, how efficient the hospital is, how new the building is, some of the reasons given for the differences in cost from the hospitals, at least. But consumers, Dory, all they're really concerned about is their bottom line. The numbers tell the story and could prescribe a change in the way health care is delivered. If you were treated in the hospital for pneumonia, let's say, and suffered major complications, the figures show major differences from hospital to hospital. The so-called sticker price at Albany Memorial, just above $14,000. On the other side of town, Albany Med runs up the bill to more than $42,000. What does this mean for the consumer right now?
You may be paying too much to get where you could get the same exact good treatment somewhere else at a much lesser cost.
The government report lists charges for 100 common treatments. From Albany Memorial to Med, a $50,000 difference for heart failure and shock procedures with complications. Do the numbers not really tell the whole story?
No, they do not.
Ellis Medicine CFO says the patient pays much less, he says, 99.9% of the time. Look at what the hospital actually receives for these heart failure cases. What you, Medicare, and your insurance company usually pay, thousands of dollars less. Albany Memorial, still the least expensive option.
Maybe at some point in time, all these prices that we get paid will be standardized, but right now, they're not. They're based on, negotiations with managed care rates. Quite frankly, our rate in Schenectady might be a little bit higher because, we're the sole provider in Schenectady County.
Rinaldi also says a patient should look at quality of care. Critics say the pricing scheme is just no more than a riddle. What could some of the long-term impacts from this be? Could there be any kind of federal legislation?
There might be a silver lining in this cloud, because if we can figure out who the low-cost people are, why it costs less, and require the others to do it, we might save a whole lot of money in health care.
Well, Albany Med has the distinction of having some of the highest charges on the list. A representative noted several factors to be considered in Medicare reimbursement rates, saying in part that as the only trauma and academic medical center in the region, Albany Med has a unique role in bringing the most advanced technology to the region. Dory?
Matt, we heard Ellis Hospital saying that the numbers don't tell the full story. Others saying they're not quite fair. Why are they saying that?
Well, partially because of charity cases that aren't listed on the whole list. And last year, the fellow that we talked to from Ellis, the CFO, said that between $15 and $16 million performed through Ellis last year on charity cases for patients over a certain level of the poverty rate. So there's a lot of numbers on the list. The first trick is trying to find out what they all mean. And the second, maybe at least in this case, is including some of the numbers that may not be on the list. Dory?
Well, certainly opening eyes at the very least. Thank you very much. Matt Markham in our newsroom tonight.